Okay, just give us a countdown when you're ready.
So it's our understanding from our clients that are at the Veterans Home that once you become a resident there, the Veterans Home takes care of their medicines and everything. Is that right?
That's correct. Yeah.
Okay, because we've had a few like, hey, we can cancel our drug plans. We don't need it.
Okay. Countdown. Okay, this is Paul Schock at the Restoration Community Church and with SCIPP, the program under the Kiwanis in Scott City, Missouri. And today we're actually going to be talking about healthcare from several different directions. And I'd like to have each panelist introduce themselves. Kevin?
Hi, I'm Kevin Colliant with the Missouri Veterans Commission. I've been with the commission for almost 15 years now. We're actually 15 years March 8th. So.
Okay.
I'm Charlie Tinsley with Thomas Insurance Group. I have, for a couple decades now, I've helped people with insurance, and we primarily focus on Medicare around the country.
Okay. If you guys can talk a little bit about your organization or your company and about some of the things that you do to actually help individuals with health insurance from the private sector to the VA. So, Kevin, if you want to start first.
Sure. Missouri Veterans Commission, we're a state agency, as the title of our agency implies. We're not the VA, but we actually operate three separate programs. We have the Veterans Homes program, which provides skilled nursing. We have 7 locations throughout the state. If you're familiar with the one in the local area here in Cape Girardeau, Veterans Homes like that provide skilled nursing. We also operate 6 veterans cemeteries. And we also have, in the program that I'm associated with, is the Veteran Service Program. We have 45 accredited veteran service officers that are accredited by the VA to represent clients and help them with their VA claims. So we help them, we screen them for all VA benefits they may be eligible for. We help them apply for those benefits, get those benefits going, and help them maintain those benefits. So that's everything from monetary benefits that you can get through VA disability compensation, the VA's pension programs, which are open for veterans of wartime periods, for veterans that are living, and also surviving spouses of veterans that served during a wartime. There is a survivor's pension that not a lot of people are aware of. So we offer survivor's benefits as well. And we also, since this is a healthcare forum, we assist with getting our veterans enrolled in the VA healthcare system. Everything from telling them what we need to complete the forms. They bring that back to us. We complete the forms, send it off for them to the point where they get the letter saying you're now enrolled.
So our primary focus is Medicare around the country. We have clients in 49 states. We're currently helping people in every state but New York. We do employer benefits primarily here in the state of Missouri, and we also help people with under 65 non-Medicare private insurance as well. It's not a big part of what we do, but we help people with that as well. And we're a little bit different than, I would say, your typical insurance company. We're not calling you. We're 99.9% referral. So all of our clients around the United States are sent in by current clients or friends or family that know someone that's a client of ours. This will sound like your typical salesperson, but we truly do focus on service and education. We don't pressure people. We're not going to call you 15 times at dinner. I was talking earlier, I mean, your phone will not blow up from us. Our thing is, if you say, hey, check with me in a couple weeks, we'll set a reminder in a couple weeks, we'll touch base, and if you go, we're doing something different or please help us, that's the direction we go. But I hate telemarketers. And so whether it's the commercials or the phone calls or the tricky little mailings, we had somebody bring in a mailing this week, and it looked like it was from the Social Security office, and it said, you have a phone appointment at this time. If you need to change your phone appointment, let us know. And it just said, enrollment center is all it said. And it did. There was teeny tiny small print that was, you could barely read, that said that it was an insurance company. And most people are not going to see that or pay attention to it. They're going to think it's going to the standard fine print, hey, we're the Social Security office, we're CMS, whatever. And so things like that are frustrating to me because so many people are misled, and it's very frustrating. We've had clients that will call us and say, we've got this new booklet in, did you change us? We didn't change them. And come to find out, somebody called them and supposedly got them to say, yes, I want to change, and put them in something totally different. And so we're totally opposite of that. I mean, I'm very upfront with people. Yes, we sell insurance for a living. This is how we get paid. But for the last almost 21 years, we've just focused on doing what's right for the person, and we don't have to call people and harass them at dinner. They're calling us.
But it sounds like, I mean, I can imagine as far as veterans too, that, and I know in the insurance industry, there's a lot of scams, especially for the senior citizens and
Very.
retired veterans. There's a lot of scams that are actually going on, so you just need to be aware of it, which is a shame that those individuals are actually at prey to trying to take advantage of them.
Yep, that's the word as you were talking, they're just preyed upon. I mean, there is no question. We see it all. We had a client in Jackson. Their daughter just happened to be at the house. Guy comes over. She said, I'm not interested. Went to close the door. He put his foot in the door. This lady's in her 80s. And the daughter said, you come around the corner, and he saw her and kind of pulled his foot back. And she said, you can either leave or we can call the sheriff. And that's terrible. I mean, it's the most, what I would say, probably the most vulnerable group in our society, and they're just being harassed and preyed upon every day.
What are some of the other issues that you guys in the health field have to deal with, and the changes that are actually out there right now in the current times? If you can address or bring some of those up.
Well, I think what I'd like to share is some of the new changes that have come about for those that are maybe experiencing problem getting their health care taken care of or health care paid for. The VA in August of last year, well, not the VA, actually Congress passed the most comprehensive piece of legislation for veterans benefits in the history of the VA, called the PACT Act. If you're veterans that are listening, you've probably heard about the PACT Act. But what the PACT Act did, it opened up and enhanced eligibility for a large group of veterans that may not have had eligibility previously. Groups of veterans who, in other words, it's more liberal getting into the system now. Yes, unfortunately, not every veteran is eligible for VA health care. So obviously, if you're a disabled veteran, there are sometimes income thresholds that you have to be under, but the new legislation actually liberalized that and opened up to a much bigger population. So what I would say is, if you had previously been denied, that you reach out to someone such as ourselves, the Missouri Veterans Commission. We have service officers here in the local area that work out of the Veterans Home in Cape. And just to have us review and make sure that you're getting everything that you're eligible for. Maybe you've been denied a disability claim. The PACT Act also created 20 new presumptive conditions for burn pits, particulate matter exposure, for our Gulf War veterans. And basically a presumptive condition, you just have to show that you have the disability served right place, right time, and the VA will compensate you for that disability. You don't even have to prove that service caused it. Just right place, right time, right disability, you can be compensated. They also added some new conditions for the Agent Orange herbicide exposure list. One of the biggest ones, high blood pressure. The VA now recognizes that herbicides could have increased your chances of getting high blood pressure. And there's several issues on that Agent Orange list. They also expanded and opened new locations where they now recognize that you could have been exposed. Guam, Any Thai air base used to, before the PACT Act, you had to show that you were on the base perimeter of a Thai base in order to have been presumed to have been exposed. Now, if you just show that you were stationed at one of those bases anywhere, they presume exposure. So it's opening up new benefits for a much larger group of our population of veterans. And the VA is trying to do a good job of mailing letters out to those veterans to say, hey, you know, the PACT Act may make you eligible for benefits you've been denied for previously. You know, please consider reaching out to a service organization for assistance. So, but it really expanded eligibility for VA health care, which I think is going to help a lot of veterans get in the system. So,
That's great.
yeah.
I know that years past, as far as a lot of the veterans of the Vietnam War had a hard time getting any of those benefits, and other VA and other veterans from other past military operations had a hard time. So that's great to actually hear.
And it's not just veterans too, it's surviving dependents and spouses of veterans too who may have been denied survivors benefits in the past should reconsider, you know, speaking to a service officer to maybe relook that and refile that claim that was denied.
Great.
Yep.
On the Medicaid, Medicare side of things, are there any changes?
There are a couple big changes, but to Kevin's point, I mean, we talk to people all the time that are like, no, I was declined because of my income, and we're going to circle back with them and let them know that now they might qualify, because we hear it all the time. I didn't know this until several years ago that there was even an income limit if you served, and I just thought, oh, okay, you get VA, but
Right.
that's not the case. No. And I have a funny story, or not funny, it's sad actually, no one found this before, but I had a gentleman come in my office, and he wasn't a client of mine, and I asked him for all of his ID cards. I wanted to see what he had, and he whips out this TRICARE card. And I was like, well, why do you have a Medicare supplement? Why do you have a Medicare drug plan? He goes, oh, that's that terrible government stuff. He goes, it's awful. And I said, have you ever used it? And he goes, oh, no, because it's terrible. I was like, TRICARE is pretty phenomenal, you know? And so we got his son involved, and sure enough, he didn't need anything. And so there are people out there that just don't know, and I'm glad you're here, because that's going to be a great resource for us. But yeah, sorry. So Medicare has some really big changes coming. So I've been very fortunate to sit on committees and boards where we've studied Canadian healthcare. We've studied different healthcare systems around the world, and in my opinion, Medicare is not perfect, but I truly believe it's one of the best healthcare systems in the world. I've seen what's out there. Nothing's perfect. The biggest problem with Medicare has always been drug cost. So if you're on Humira, if you're on Stelara, Eliquis, Xarelto, Jardiance, Januvia, some of these medications are extremely expensive, and you take them every month, and you're going to be on them for the rest of your life. So in 2024, they're going to remove the catastrophic level on the Medicare drugs, and then in 2025, they're actually capping the max you can be out on covered drugs to $2,000. That sounds like a lot of money, but you know, we have a lady right now that will not retire. She can afford to retire other than she takes Stelara. With her insurance, it's still going to cost her $16,000 a year. She can't afford that. I mean, she could, but she would go broke pretty quick. And so she believes she's been approved for a grant, so hopefully that'll kick in and she'll be able to retire. But with some of the changes that they're bringing, that's going to resolve that. You're going to see more people not keep working because they're on Humira, Stelara. You know, there's so many drugs. The list goes on and on. I mean, there's hundreds of drugs now that are $1, $0, a couple of dollars. That's great if you qualify for if those drugs help you. But some of these drugs are anywhere from anymore. What I call an expensive drug used to be $400. Now what I call an expensive drug is $10,000 a month, $20,000 a month, $25,000 a month. And when you're on those kind of drugs, if you don't get a grant, if you're not getting some type of assistance from the manufacturer, how can you afford that? I mean, even with insurance, it's just unbearable. It's breaking people every day. So that's been my biggest complaint about Medicare. On the medical side, it's absolutely incredible. And they're going to finally attack that and fix that. Another thing that I never understood is Medicare has not been able to negotiate the price of drugs. I mean, it's above my pay grade, but, you know, politicians, I'm sure everybody's got their reasons behind this, but they're finally going to start negotiating drugs. They're going to start with 10, we'll take it, and then they're going to add a couple each year and go from there. What's really sad about our drugs, and not to get political during this is about insurance, but, you know, when people talk about, well, I'll get it from Canada, you can get it from New Zealand, you can get it from Australia, you can get it from Great Britain, you can get it from Turkey. They buy their drugs. Here's a statistic. New Zealand has about 5 million people. The United States has, 350 million people. New Zealanders pay on average 65% less than people in the United States for their drugs because of their negotiations. How do we not have that? How are we not taking care of people? I bet the United States buys more pharmaceuticals than any country in the world, and we're paying more than everyone else. So again, I won't get on that soapbox, but there are some fixes coming. So we've got clients that we've already started talking to that it's a pain point for them every year. It's taking everything they have to buy their medicines, and there's some light at least at the end of the tunnel now.
It is a hard thing. It's grateful that the insulin cap was out there because there's a lot of people that are actually on insulin and couldn't afford it.
Mm-hmm.
And the costs were just being so high. I knew when my dad was alive, he was a diabetic and he had a dog. And odd thing is, he found out the dog was taking the same insulin
Mm-hmm.
as he was,
Mm-hmm.
and the dog's insulin was just a fraction of
Mm-hmm.
the cost. And you do have to scratch your head.
You do. The dog insulin was running about an average of $25. It's actually come up a little bit. But yeah, several years ago, so you've seen on the news, you know, that some of the manufacturers are going to cap their insulin at $35. But on the Medicare side, most plans had already capped insulin at $35, participating insulin. The frustrating thing is people think that's all diabetes drugs, and they find out very quickly it's not. Jardiance, Januvia, Ozempic is crazy expensive, and now because of celebrities talking about how they lost weight on it, it's the supply and demand is even worse, and it's getting harder to find. It's more expensive.
I mean, you have the EpiPen phenomenal for a while, $650
Yep.
for just an
Yeah.
EpiPen. And then the other thing was inhalers for kids.
Yes.
I mean, people are paying $200 to $400 a month for an inhaler for their child or themselves.
I will say, and this doesn't have anything to do with Medicare, anyone can use this. There's GoodRx that's been around for a really long time, but there's something new. There's a couple newer ones. The one that we're probably finding the cheapest drugs with, and they're adding drugs every month. It's not, there's a couple hundred out there, but Mark Cuban has an online pharmacy called costplusdrugs.com, and it's by mail order only, but it's incredible what he sells his drugs for. I watched an interview, Consumer Reports has done some things on it, and he has a flat 15% markup on his drugs. And when I first heard that, I thought, okay, what's normal? We're finding now that some drugs are marked up thousands of a percent. There's a cancer drug that Cuban has on his pharmacy that the suggested price for 3 months, I think, is $3,300, and he's selling it for $141.
Wow.
And so whether you're on Medicare or no insurance or, you know, whatever you're doing, it's probably worth looking into that. There's another one called GoGo Meds. We've been using that for probably 5 or 6 years. And GoGo Meds, again, it's a mail order only, and they just have a very low margin because they're mailing it directly to you. They don't take insurance. It's just cash. But believe it or not, a lot of your generics. Now, if you're on Medicare, a lot of what they call Tier 1 and Tier 2 generics are anywhere from $0 to $5. So it's hard to beat that. But for people that aren't on Medicare, some of these drugs that, you know, and I love local pharmacies. I use a local pharmacy, but the price might be substantially higher than ordering it from their website. You might get, I'm going to make this up, levothyroxine, which is a very, very common thyroid drug. your local pharmacy might sell it to you for $20 a month. You might be able to buy 3 months worth from Cuban's pharmacy for $4. And so there are ways to help with the cost of the medicines, and that's one of the things that we do is there's single care. There's so many of these, and we'll look at 5 or 6 at least to just try to make sure we can't save people money that way. Insurance isn't always the answer. Sometimes some of these discount programs or these online pharmacies are actually cheaper.
I'm sure on the VA side, that's a big issue too, as far as getting prescriptions and paying for the prescriptions on the top of it.
Right, and that's a good point. One of the other huge benefits of being enrolled in the VA healthcare system is the prescription medication benefit that comes with being enrolled, and that can really save veterans a lot of money on prescription medications, many times with no copay whatsoever. So there's different factors that are factored in, whether or not you have to pay a copay for your medications, whether the medication is treating a service-related disability, and if the medicine is for that, then obviously there's no copay. Our veterans who are rated 50% disabled or higher pay no copays for any VA health care that they receive, whether it's for a service-connected disability or non-service-connected. And our veterans who are lower income also will not have to pay a copay once they're enrolled in the VA healthcare system. I can tell you all my prescribed medicines are provided by the VA. It's very convenient. They mail them to me, and I refill them by logging into my Healthy Vet. I have a VA account, and I just go in there and basically the touch of a button, hit refill, and I get them refilled, and they show up in the mail 3 to 5 days later. Generally, maybe a little longer than that. But
And I know that there's probably a lot of veterans that really haven't taken advantage of the opportunities that are actually out there for the VA, and have that same idea that you had said, that they just they don't think that's to be beneficial for them.
true, and some of them were denied years ago, and the laws changed several times since they applied, so they could have probably re-enrolled years ago and been in the system, right? So we would just strongly recommend that anyone, and if you've never sought or talked to a service officer and have been screened for your benefits, to do that first visit so we can go through. We'll make sure you get everything you're entitled to. That's what we're paid for, at no cost, too, by the way. We're not allowed to take any compensation for what we do.
And I know I've talked to a couple of retired vets and teachers and a couple of people in the service fields. They have told me, well, one of the things that I'm trying to deal with is, one, I got health insurance benefits from being a teacher. And so if I start taking something from the VA, I'm going to lose out on my health insurance as far as the teacher.
I don't know that you're losing out on anything. I'm kind of in that boat myself. I'm retired military, so I have TRICARE. And I have a supplement that I pay for through state employment that the state offers that supplements my TRICARE, and I use the VA as well. So I actually got the best of both worlds. I pick and choose those things that I want to receive treatment and use my TRICARE benefit through a private physician. And I choose my VA primary care provider, to stay active. I have to see them at least once a year to stay active in the VA's healthcare system. And so, and they do a good job now communicating with each other. They can share your medical records back and forth between the VA and your private provider as well.
Well, that's great.
Yeah. So you get that coordinated healthcare effort.
The other things, we talked about the prescriptions, and I think that's a big issue. We have to realize, too, there's a lot of people that are actually out there that, whether it's from Obama, now it's Biden care, can't even afford that. And I think the ratio is we're still almost a half of the states aren't insured, because a lot of people are actually getting minimum wage or they're self-employed, and they can't afford, was it $750 a month at minimum, plus $5,000 to $7,000 copay as far as a year, and how do you actually pay for the insurance when you can barely scrap by and something does happen and you actually have to pay for the copay at the same time, and balancing paying the insurance the same month and then having to pay for your mortgage or rent or your utilities. I mean, I know it's overwhelming for a lot of people. And so it almost becomes stagnant in the sense that you become numb by basically saying, there's nothing I can do.
In the state of Missouri and really southeast Missouri, so what a lot of people don't realize is healthcare is a lot more expensive in southeast Missouri than it is in the St. Louis region. So health insurance, on average, I haven't looked at this in the last year, but it used to be about 20% more expensive in Cape Girardeau than it was in St. Louis. And the Affordable Care Act, I've seen it help people. I've seen it hurt people. It's gone both ways. If you don't make the minimum income requirements, you get no help. And you're right, the premiums are outrageous. The max out of pocket might be $8,000, $9,000. If you make above the minimum, but you're close to the minimum, your premiums might be zero, your max out of pocket might be $200 a year. So for that bracket of people, it's phenomenal. The one side note to that, though, is network. So, St. Francis doesn't take affordable care plans, and when they are buying up clinic after clinic, and I'm not picking on them, it's a financial thing. They have to be able to pay their bills. They have to be able to pay their doctors and things, but it's a lot of people, that's where they want to go, and especially if you live in the Boot Hill.
Yeah.
I'm from Charleston. Kevin's from Kennett. You get down in that area, and St. Francis has bought up a lot of the practices. And so if you're on the Affordable Care Act, you have very few choices. I remember when they bought Ferguson Medical Group, all of my customers that were on the Affordable Care Act instantly lost in-network providers. They made it work. They just found a new provider. They paid cash, something like that. But the Affordable Care Act, it's also known as Obamacare, and it can help people, but the costs are pretty high if you don't meet that income bracket, and then access to care can be limited. Outside of that, you can look at a Medi-Share plan. They're gaining popularity, but as they gain popularity, their premiums are going up. I can remember years ago, they were dirt cheap. They did, they were acting as a Medi-Share plan. Now some of them are trying to act very similar to an insurance. You get a card. They have, what they call a PPO network. You give it, they file it, but now the premiums have gone way up. And they underwrite, and they have pre-existing conditions where back in the day, they would take anybody and they'll start paying day one and things like that. So those plans are even having to adjust because of the high cost of claims. You can buy short-term plans, which you still have to go through medical underwriting for. They can be cheaper, and they can be a really good fit if you only need it for a few months, maybe a year or two. But outside of that, they're not necessarily the greatest option either. Employers are battling this every day. We see it nonstop. The biggest line item in a budget for most employers is health insurance. It's incredible. I mean, it's just the prices are going through the roof right now.
And I think that's partially why even though that the hourly rate's gone up for minimum wage, it still doesn't allow individuals to get health insurance off of that height. And a lot of the employees aren't bringing them up to full time because they don't want to pay the health insurance.
Right.
And so it's a double-edged sword. And,
It is.
and I know it's a big problem across the board of how do you actually deal with that. I know as I understand, historically in the 50s, I mean, even back in the 30s, Depression, all the way up to the 80s, there was a lot of preventive care that was going on in communities along with cities. And it seems like during the 90s and 2000, that a lot of that was pushed aside as far as preventive care facilities that were almost free to deal with more of the individual doctors or now the nurse practitioners. And I don't know if there's ways or if there's facilities that are actually trying to go back to that at all.
Most insurance plans now are covering preventative care, whether it's the Affordable Care Act, whether it's short-term, whether it's Medicare. I mean, most preventative care is covered now at very little to no cost, and that's a good thing, because you're right. We saw it during the COVID lockdowns. You know, people stopped going to the doctor. They stopped having preventative care done because they didn't want to be in the doctor's office. Who's there? Sick people. They didn't want to go to the hospital. Who's there? Sick people. And so now we're seeing people going back, and that's utilization or claims are going through the roof because people are back out. They're feeling more comfortable about going to the doctor, getting their preventative care done and things like that. And they're finding things that should have been found 2 years ago, but they did not want to go into their doctor's office. And that's how do we handle that in the future? I don't know. Luckily I don't have to figure that out.
I understand.
Yeah. But if that happens again, it does worry me because we are starting to see all these health conditions that were not treated because people just did not want to go to the doctor. And but preventative care is, for the most part, now is being covered by almost anything out there, which is really good. I think the next thing we'll have to tackle is these high out-of-pockets. If you buy an insurance policy and your max out-of-pocket is $9,000,
That's a hard one. And you can't get a loan for it.
no, that's tough. It's tough. We talk about in the office a lot. This job doesn't require a lot, just requires a little bit of compassion and patience. And it's hard when you're sitting there and somebody's looking at you and they're just crushed because they hear what it's going to cost. Then they hear that, oh, you've got to pay for the first $6,000, and then you're going to pay for maybe another $2,000 at 20% or 50%. And they're just sitting there thinking, I can't afford that. Like I thought I could get health insurance, but now I'm thinking, why should I? Because if I can't afford this deductible, why pay the premium? So that's tough. That's a hard thing to work with.
And then on top of that, if you have someone that has a pre-existing situation, it's almost impossible.
It is. I tell people every day, so I'll have clients come in and they'll go, well, I can't believe it, but I'm turning 65. I just can't believe it. And I go, well, that's a good thing. And they'll look at me like I'm crazy, and I'll go, believe it or not, it's not perfect, but Medicare's pretty awesome. And so once we get done explaining how Medicare works, you can just see like this weight off of them. And I don't, people are going to criticize me going, oh, it's got this problem and that problem. It is not perfect, but I truly believe it. Next to TRICARE, I think it might be the best thing out there. And so, yeah, I just tell people, hang on, when they're 63, 64, 65. And that's literally, we've had that conversation. I just need to hang on until I can turn 65. I thought 2 years ago, we were going to see Congress vote to lower the limit for Medicare to 60 or 55. And then between Ukraine and everything else, it just wasn't a priority anymore. The biggest thing is you have to make sure you can afford it, because as they add things like the cap to Medicare drugs, as they add these things, the biggest concern is don't bankrupt the system, because we have a lot of people that we need to take care of on Medicare and make sure that they don't lose the benefits they have today by adding more benefits. But hopefully they'll continue to improve it. They'll continue to make drugs more affordable. And more people will be able to get onto Medicare and solve some of this crisis that we have. And it's a crisis. I think sometimes people think insurance agents don't care and, well, whatever, they just want to sell something. And I think the majority of insurance agents really do care about, I hope they care about their customers, and I hope they care what they're doing. And so I think we're going to see improvements. I think we're going to continue to see innovation. And with people like Kevin helping veterans, he's mentioned it and I mentioned it earlier, it is amazing how many people I'll say, well, do you have VA benefits? Well, I have access to it, but I'm not, no, I'm not doing that. I don't know why. I haven't figured that out yet. They earned it, and they should take advantage of it. And it is. We have people on VA right now that they have a drug plan with Medicare because they can get a lot of their drugs for $0, but through the VA, maybe they're paying $8. Okay, if you can save $8 every 3 months, why not? If it makes it worthwhile. You know, if you can buy a drug plan for $10, $11, and then get several drugs for free, it makes sense. But then we have guys that and ladies that are getting their drugs for nothing or next to nothing, and they don't need a drug plan. And so, and you don't get a penalty if you have VA benefits and you don't buy a Medicare drug plan, you don't get the same penalty as people that don't buy a Medicare drug plan that don't have VA benefits. And so we try to convince them, don't spend money you don't need to.
Yeah,
You know,
which is true. Are there some things that you see, as you were talking about, some things that are going to be changing hopefully in the years to come? Do you see that in the VA as far as veterans?
Well, and like I said, the PACT Act just, in addition, I'll say this as well, this is a great time to try to get enrolled if you haven't before. And we have this awesome new healthcare center here in Cape Girardeau. The VA, one of the things the PACT Act did, it gave approval for 31 new facilities across the United States. So the VA is improving access, also physically trying to get closer to the veterans so they don't have to drive as far, number one. This healthcare center here in Cape is a great benefit for our veterans because those that used to have to travel to VA Medical Center, Poplar Bluff, or even John Cochran sometimes, they can get a lot of that care done right here locally at this new healthcare center. It's actually unofficially titled a super clinic. They provide many of the services that you can get at the VA medical centers or the VA hospitals, right? I mean, they have their own optometry clinic, audiology clinic there. They have a pharmacy there at this new healthcare center. They have physical therapy. They have an enhanced mental health facility with counselors and doctors to treat those unique issues that our veterans have, right? They have a podiatrist. They have chiropractor on staff. That's new. And many others, some things I'm not thinking of. But I used to have to travel once a year to get my VA glasses right here, no cost, to Poplar Bluff. Now I get my exam right here in Cape Girardeau. So great time to try to get enrolled if you haven't. Now, I want to clear one thing up. I don't want to give the impression that the income threshold is keeping a lot of veterans out. That's actually the exception. Most of those we apply for, they either get enhanced eligibility and they get in the system, they meet the criteria for enhanced eligibility. And even let's say you're in that small group of veterans who has income over the income threshold at the VA. If I can get you service connected for one service-related disability, then the income threshold and limits are out the window for you. It doesn't matter what you make. The VA has to let you in for that. So,
And I think you're touching upon something that, as we're talking about, there's a lot of VA veterans that are actually haven't taken advantage of the facilities and taken advantage of their rights. And I think some of them are used to the old system where they think most of the VA facilities, hospitals and that, they were actually long waiting times. There were actually the facilities or the care was not the greatest. That was actually better to actually have regular insurance, see a regular doctor because of how bad they thought things were.
right.
And from what you're talking about, it's like it's a total night and day.
It really is, and I've seen just in my 15 years with the commission involved in this business, I've seen it evolve and make great strides in improving the care that's provided, and the VA and Congress is, throwing a lot more money at it, and sometimes that's what it takes to fix problems and to hire more doctors, build more hospitals, more clinics, more access to healthcare for veterans, more convenience.
And I'm sure on veterans, along with on the commercial insurance side of things, as far as individuals, right now I think it's very massive as far as a lot of the things that are going on in the medical field, whether it's pharmaceuticals, but also on the doctor side. I was just bringing up nurses' aides to doctors. Sometimes there are an individual has to go deal with so many different doctors that not all the doctors know what's going on with what prescriptions or what treatment's being taken care of on this individual. There's no cohesion at times. Right. And then the other thing that happens sometimes is that, hey, you got a heart problem, but we can't schedule you for another 3 months. Right. And do you see any of that ever changing?
Oh, it has. That's one of the things that's changed considerably also. 5 to 10 years, where you heard the horror stories about having to wait long periods of time before you got your procedures done. Well, the Mission Act, this was another big act on the healthcare side. I think it was back in 2017 or 18. It really expanded community care for veterans. And essentially, if you have to wait over a certain period of time, the VA has to go out and try to find you care in the community to meet that need. Okay, so a lot of what gets done is referred and paid by the VA out in private care, private doctors and private hospitals and private specialists. Okay, whether it's your gastroenterologist, taking care of those kinds of issues, heart specialist. I personally, I was sent to St. Louis, and I got to choose the doctor I wanted to see to evaluate a shoulder condition, paid for by the VA, because the VA didn't have the appointment space to meet my needs in a timely, manner. So there is a lot more than that. And I will tell you another thing that the Mission Act did is it created this urgent care benefit now. So essentially, if you go into, now this is to treat things like colds and earaches, nothing life-threatening, obviously, just not feeling well, things that, you wouldn't be showing up to the emergency room for, minor injuries, not broken bones. But if you have an illness like that, you can now show up to one of the VA's in-care facilities that's in their network, and without prior approval from the VA. Okay? Just call them and make an appointment. Now, we actually have 2 that are in VA's network here in the local area, MedStop 1 and St. Francis Immediate Healthcare. We're on Kings Highway. So you don't even have to go through the VA, and depending, there's some factors involved, and some groups of veterans get 3 of those a year at no cost, no copay, and depending on if you're rated disabilities by the VA, you may be entitled to more with no copays as well. But that's another thing where they've tried to expand and improve access to care. To get around those long wait lines that you're talking about. But a lot of those special needs where it requires a specialist of some kind, those are getting referred out into the community to get taken care of, and the VA pays for that.
That's great.
Yeah.
Are the medications, because we're hearing a lot of good things about the new facility. It's right down from our office, and people are loving
awesome.
it. Yeah. The chiropractor's been a big hit. I've had several people talk about that. But
Yep.
Are the medications the same if you go in and pick them up as if you do the mail order? Price-wise, sorry.
Oh, from the VA? Mm-hmm. Yeah, no, there's no difference whether they mail them to you or...
Because we have several that they don't like mail order, so we could tell them they could just walk in and pay the same price and get them right there.
Yeah, and that's not even, you would never just pay something when you walk in there anyway. The VA would bill you if you were in a group where you have to pay a copay. And I think the copays are very affordable myself. Mm-hmm. I mean, I have some medications that are for service-related disabilities, so I'll never have a copay for those, right? And then they're treating some things that aren't service-connected. And so I think I pay $15 for a 90-day supply is my copay for that. So, and I get a bill and just in the mail for that. So, yeah, and it's very affordable. And you're right, there are some who might be able to get it a little cheaper, through their TRICARE benefit. It all just got to weigh whether it's more convenient to do it one way or another, or how much money you're saving. But yeah, that the new healthcare center, I have nothing but good things to say about that. So, and very convenient for veterans in the local area. So there's very few things that you should have to travel long distances for now for your care, because most of the specialties are being offered right here.
That's great.
Yeah, or they'll send you out and do a referral or a consult for community care from a private doctor or specialist.
That's amazing, and it's great that actually I mean, a lot of us actually seen that being constructed over time, and it's just great to actually see it being facilitated and utilized that way.
Right.
Update on dental? That has always been a
You know, there's not been real big changes in dental for veterans. That is a hard benefit to get, right? So, and we get that question a lot, how do I get my dental care? And I wish there was, and I'm not saying VA's not working on this, but I hope they're able to work and expand care for dental needs for our veterans. But right now, that care is, obviously, if you have a service-related dental issue, they'll take care of that, right? Or if you're 100% disabled by the VA, you get your dental care. Also, if you are a POW, they're going to take care of those with dental needs. And some others, if they can show like you have some service-related disabilities that are leading to dental problems, like a secondary problem, then they'll take care of that as well. But there's nothing new that has changed as far as who gets that care.
And
It's a
hearing
good point,
aids
though. Hearing aids, it used to be you had to be basically service connected for a disability to get hearing aids. You don't have to be anymore. If you're enrolled in the VA healthcare system and the VA determines that you need hearing aids, you have hearing loss, you can get hearing aids, and you can get some really nice hearing aids, and they've got a lot of different options.
even if you have other insurance.
Well, the VA can bill your insurance if you have insurance, just know that as well. Yeah, but,
Okay,
yeah.
great.
Mm-hmm.
Do you see on the private side of insurance anything else down the line changing that we need to be aware of? Whether it's, I know that there's a lot of supplements for dealing with a lot of the senior citizens, but I also know that even on the private side, whether you're an individual getting your own insurance, whether you're going through a company, that there's a lot of things changing too. And it's always, it seems like it goes almost, was it every 5 years that they try to develop things?
It's every big election.
Gotcha.
So, if it's a big election cycle, you're going to hear that they're going to make everything amazing and it's going to be the best ever. And then when the election's over, it's back to business as usual. And I think it's just how many ways can you split a dollar is probably the biggest thing. But as far as what do I see coming, there's no telling. It truly depends on who's in power and how passionate they really are about healthcare. There's got to be a fix, and people ask me, what would you do? And I always go, I have no idea. I don't know how we fix this. I truly don't.
I know at times we actually put Band-Aids on things and then just makes it a little harder to deal with, and so many
Yep.
Band-Aids that you can't really peel just one. There's too many there to actually peel off. And I think the hard thing is seeing, especially in the Boot Hills, we know, is that there's a lot of families with single families that with kids and even the mothers that aren't insured, and it's hard to actually them deal with day to day of just surviving, and there's no quick easy fix.
No, and I'll comment on that. So I hear people all the time say, I'm not signing my kids up for Medicaid. That insurance is terrible. It's kind of like the VA. And from what we've seen, the Medicaid system for kids is pretty outstanding. I mean, it's very reasonable, if any cost at all. very low copays, if any cost at all, and most providers are going to accept it. And so, talking about that, I mean, I would say if you're a single parent, you've got some kids, you should look at, do they qualify for Missouri Health Net, something like that, because it could really make a difference in that kid's health and well-being. I don't know how we fix it. I don't see anything major coming. I think the fix will be through Medicare. I really do. It's just a matter of, can they afford it, and how do they make it work from a dollar standpoint. But expanding Medicare, I think, in my opinion, might be the fix. I really thought they were going to drop it to 55 or 60, and they didn't. So I think if we can see, even if they drop it to 60, let's see how that works for a couple years. If it works, great. Look at 55. If it doesn't work, then go, oh, we almost ruined this. Let's hold up. But I think that's one way.
We have a question from the audience.
Yeah, I was wondering, I'm not sure about this, but to get dental and eye care, you can't get that through Medicare, you have to get it through Medicare Advantage?
Yeah, so with Medicare, you have a few options. You can take just Medicare A and B and not have a supplement or a drug plan or an Advantage plan. I don't recommend that. For the people that tell us, well, we can't afford a supplement, we do recommend at least buying an Advantage plan. In most cases, I have to speak in general. I can't give set coverages because it's illegal. This is not anyway, it's CMS rules. But you can buy a standalone dental and or vision plan to go with your Medicare supplement and Medicare drug plan. But you're right, Medicare will cover cataract, macular degeneration, and glaucoma, the big items, but it's not really going to be there to, cover cleanings and fillings, root canals, bridges. Those are very expensive, and you're right. If you don't want to pay for something additional, the only way to get those coverages currently are through a Medicare Advantage plan.
If you switch over to Medicare Advantage, can you go back to your regular?
You can. So there's a lot of confusion there. I hear this every day, and it doesn't help that a lot of brokers, insurance agents, don't actually know either. So if you're turning 65 and you're going on Medicare, and your Medicare A, Medicare B, and your Medicare Advantage plan have the exact same effective dates. So let's say that you're turning 65 in the month of May, and you're going to take all your benefits May 1st when Medicare goes into effect. Okay. You have a 12-month trial right. So you can try that Advantage plan for 12 months. If you don't like it, you can pick up a Medicare supplement, no questions asked. And you can go back to original Medicare A and B. Okay. If your Medicare Part A started June 1st of 2020, but you delayed Part B, you don't want to do that because you're not going to get that trial right. All the effective dates have to be the same. Okay. If you buy a Medicare supplement, and then a year down the road, a month down the road, if you qualify, or 6 years down the road, you decide, I want to try that thing that I see on TV. I want that all-inclusive. I got all my benefits. I called this 800 number, and they're mowing my yard, and they're cutting my hair and all that. They don't work like that, but they make it seem like it. If you pick it up later, you get a 12-month trial right. So Medicare says, if you want to try a Medicare Advantage plan once, you get one shot at this. That's it. You buy it, starts January 1st. You've got that year to decide if you like it. And if you don't, you can go back to the supplemental plan you had before. If that supplemental plan's not available, you can pick up a different supplemental plan. Okay. Where there's confusion is people say, if I buy an Advantage plan, I'll never get Medicare back. That is incorrect. You can always get Medicare A and B back from the government. It's the supplement you may have to go through medical underwriting for. So original Medicare A and B benefits, you can pick that up anytime. Well, no, I won't say anytime, but every year you can pick it up. So you can be on an Advantage plan for 5 years and decide, I want to go back to Medicare. Okay, that's fine. You can go back on Medicare A and B. You may not be able to pick up a supplement, though, so you might have to answer health questions. Missouri is very unique. We're the only state in the country that has what they call the Missouri Anniversary Rule, where you can change your Medicare supplement. If you have one, you can change from Plan G to Plan G to Plan G, Plan F, Plan F, Plan F, Plan N, and so on, every single year at your anniversary date. So we call every single customer we have nationwide, not just in Missouri, we call them all, on or before their anniversary date to go over options with them. And you can change in Missouri, no problem. Other states aren't that way. There's 13 states that have similar rules, and then the other 37, you don't. But the one thing that gets very confusing for people is they think if I buy a Medicare Advantage plan, I'll never get original Medicare back, and that is not true. You can, every year you can get original Medicare back. It's just, can I get that supplement? So the big thing that people get worried about is if I go in a nursing home and I get on Medicaid, I can't ever get a Medicare back. You can. So if you ever qualify for full Medicaid and you want to just to have Medicare and Medicaid, you can go right back onto Medicare, no problem, and have Medicare and Medicaid. So I personally today wouldn't buy a Medicare Advantage plan if I could afford a supplement. But I will say nationwide, 20% of our customers now have it, and 5 years ago it was less than 0.1%. So that number is growing fast. Medicare estimates that more than 50% of Americans by the end of 2023 will be on a Medicare Advantage plan. And in some parts of the country, we can't sell anything but a Medicare Advantage plan. There are parts of the United States where you can buy a zero premium plan with a $800 max out of pocket, dental, vision, hearing, over the counter, transportation, life alert, help I fall and I can't get up. They might even cover some of your utility bills. And we have plans now the commercials are true. There are plans that will pay you money back towards your Medicare Part B premium. A lot of our veterans that use VA for everything are picking up an Advantage plan. It's just a backup. They're not ever planning on going somewhere other than the VA. And the reason they're doing that is it's a zero premium. They can get upwards of $100 a month back on their Medicare Part B. They're getting dental, vision, hearing, and over-the-counters, and they never go to a private doctor. But if they do go to an in-network private doctor, it's a zero copay. So it gives them the flexibility of, I like the VA, I want to stay in the VA, but hey, I'd like some of these extras, and I'll get some money back. Now, if a veteran comes in and they go, I never go to the VA, I go, okay, then here's what I would recommend, but we do offer this plan if you'd like. So everybody's different. If you call an insurance agent and they just keep pushing one thing and they don't want to talk to you about other options, they're not wanting to educate you on what's out there, that's probably a problem. Whether it's, there are agents that sell only Medicare supplements. There are agents that only sell Medicare Advantage plans. There are agents that only sell one type of plan. That's a problem. They really should listen to you. They should ask you questions. They should try to figure out what's best for you, because there's not one plan that's right for everybody. I used to feel like Medicare Advantage plans were going to be the downfall of the world. I just hated them. I didn't want to sell them. And then I realized we had customers that were struggling to buy groceries. Do I buy groceries or do I pay my Medicare supplement bill? That's a problem. That's when I realized I was part of the problem. Because I was telling people, don't buy this, never buy this plan, never let anyone sell this to you. And then I realized people were really struggling. So I don't recommend it first, but there are people that love it. I have clients that have been on it for 3 and 4 years. They've had surgeries, they've hospital stays, skilled nursing stays, and they're like, oh, it was amazing. It was fantastic. I love it. Yeah, we're not changing anything. So everybody's a little different.
Well, I think the panelists for everything, one of the things I think came up throughout the conversation, if you're a VA, do make an appointment to find out about information about being a VA and the benefits that you actually have.
Right.
As far as most veterans don't know this, and I think it's good information to have. And if you actually have insurance, you might want to call up your agent, call you up, to find out more information on what you can get, especially if you're a senior citizen, what's the best thing that's out there.
Absolutely.
And then individuals that don't have insurance, I know, Bob, you're actually going to probably put at the end those phone numbers of people can actually contact as far as if you don't have insurance, ways to deal with, and
Sure.
everyone's phone number will be on there. But thank you very much for your time and your patience, and hopefully it's some good information for the